Hello and welcome to Sophy Ridge on Sunday. Just when you think we're in the clear, COVID-19 finds another way to bring us back down to earth. Restrictions in England will be loosened tomorrow, but the next stage of the roadmap could be at risk because of the so-called India variant. It's the latest cruel twist in a journey that's had many of them. But the big difference now is vaccines. 56 million vaccine doses have now been given out in the UK, most of them to the older people and more vulnerable, leading some to wonder whether we really need to worry about this variant. Well, today we've got the lineup to answer some of those questions. In just a moment, the Health Secretary Matt Hancock will be joining us. Sir Mark Walport, the former Government Chief Scientific Advisor who sits on SAGE, will also be on the show, as will Professor Adam Finn, a member of the Joint Committee on Vaccinations, to answer some of those crucial questions about how jabs affect the variant. We'll also be joined by Steve Reed, Labour's Shadow Communities Secretary. First, though, we can go straight to central London and talk to the Health Secretary, Matt Hancock, on the programme today. Thank you very much for being with us, Health Secretary. Can you just give us the latest figures on how widespread this India variant is in the United Kingdom?
Well, in total, we've seen just over 1,300 cases of this Indian variant. It is becoming the dominant strain in some parts of the country, for instance in Bolton and in Blackburn, and it's there in smaller numbers, much lower numbers in other parts of the country. One of the advantages we now have compared to the past, compared to December when we saw the Kent variant coming up, is that we have the vaccination programme, as you mentioned, but we also have this incredible testing and surveillance system. So we can see these cases even though the numbers are really quite small at the moment, which means that we're able to take this cautious step forward tomorrow and continue on the roadmap whilst monitoring this very, very carefully and taking specific action in the areas where we can see the prevalence of this new variant, like Bolton.
Talking about the surveillance system, so we can really monitor how this new variant moves. So what does the data show us? We were told on Friday that it's likely to be more transmissible, but that vaccines do seem to be working against it. Is that still the case?
Yes. So there is new, very early data out from Oxford University, and I would stress that this is from the labs. It's not clinical data, and it is very early, but it does give us a degree of confidence that the vaccines work against this Indian variant, but it is clearly more transmissible and has been spreading fast in the groups where there's a cluster. And that means that we can stay on course with our strategy of using the vaccine to deal with this pandemic and of opening up carefully and cautiously, but we do need to be really very vigilant to the spread of the disease. And the metaphor the Prime Minister uses is the right one. We're in a race between the vaccination programme and the virus, and this new variant has given the virus some extra legs in that race, but the vaccine will still, we have a high degree of confidence that the vaccine will overcome. And so the main message I've got for everybody this morning is get vaccinated. If you're in one of the eligible groups, come forward and get a jab. In Bolton, where we've seen a number of people in hospital with this new Indian variant, the vast majority of them have been eligible for a jab but not taken the jab. So if you're eligible for the jab, if you're over the age of 38, please come forward, because we know that the jab protects you, and we know that with a high degree of confidence that the jab will have an effect against this new variant too.
What I guess I struggle to understand, what some others might struggle to understand, is you say there's a high confidence that the vaccines work against the variant, and I accept your point that the vast majority of people in the hotspots in hospital are those who are unvaccinated. But at the same time, more than 56 million vaccine doses have been given out. The vast majority of people over the age of 50, people in the most vulnerable groups, have had at least one dose. Why should we be talking about even June being blown off course, if we know that the vaccines work and so many people have been vaccinated? Like, who is going to be in the hospitals?
Well, the answer is that because this variant can spread even faster than the Kent variant that we saw, and we saw what happened with that in December, it means that if it gets out of hand, we'll have a very, very large number of cases. And so even with the protection that the vaccine gives you, that is, the vaccine protection is very high, but it is not absolute. 97% protection against dying from COVID is fantastic, but it isn't 100. And so we do need to make sure that we don't get that total, that explosion in cases. So we need to be cautious, we need to be careful, we need to be vigilant. And we've said at each step, we will look at the 4 tests that we have. We assessed those last week for the tests, for the move that we're making as a country tomorrow. And our assessment was all 4 are met. The 4th of those 4 tests is whether a new variant knocks us off course. And we'll of course be assessing that over the weeks to come, and we'll make a final decision for the step 4, which is the biggest step on the roadmap. We'll make that final decision on the 14th of June. So we always said we want this to be cautious. We really want it to be irreversible. New variants are one of the biggest risks to this opening. Because of the speed of transmission of this one, it can really spread like wildfire amongst the unvaccinated groups. Hence, we need to get as many people vaccinated as possible, particularly in those who are most vulnerable to ending up in hospital.
Listening to what you're saying there, the spread is clearly something that we're still very worried about. And even though the vaccines work, they may not work for everybody. Tomorrow,
yes,
of course,
it's because of a law of large. Because of a law of large numbers. Even though the vaccine gives you that huge amount of protection, it is, if you get a very large number of cases, that clearly
some people
has a knock-on in terms of hospitalisations.
So some people who've been vaccinated, frankly, could still end up in hospital and could still die.
Well, a very small proportion. That's true under the existing variants as well. It's the flip side of saying 97% protection against death is that does still leave that 3% chance. That's one of the reasons why over the long term, we talk about where we want to get to with this disease as managing it like flu. People get vaccinated for flu every year as well. And it's all about getting the risks down to a manageable level and making sure that we don't see a big increase like we saw with the Kent variant. But the difference between now and December is both we've got the vaccine, which is great and protects people from hospitalisation, but also we have this amazing testing and surveillance system, so we can send in the surge testing into places like Bolton and Blackburn. 35,000 people we're trying to reach over this weekend. Even
despite that, SAGE are still very worried about this reopening that is happening tomorrow. Indoor socialising, up to 6 people, pubs, restaurants, homes. I mean, exactly the kind of conditions, of course, that COVID-19 likes inside. And just looking at the latest minutes, so SAGE saying that if this variant is 40 to 50% more transmissible than the Kent variant, that's what Chris Whitty suggested is very possible, then it's likely that tomorrow's changes would lead to a substantial resurgence of hospitalisations similar to or larger than previous peaks. If that is the case, why are we proceeding with the reopening tomorrow?
Well, the most important word in that sentence, and obviously I not only have seen those minutes, but I've also talked to the scientists who are following this with us and advising on it. The most important word in that sentence is if. We don't know yet the increase in transmissibility. What we do know is it is highly likely that...
We know that it's very possible that it is 50%, and surely people would understand that why don't we wait until we do know how transmissible it is, even if it's a matter of a couple of weeks?
The thing is, though, Sophie, and I know that you get this, it's often quite hard to communicate. Epidemiology is all about the balance of risks, and there are no absolutes, as our discussion just now about the protection you get from the vaccine demonstrates. If the transmissibility is as high as that, then we will have a problem. And we've been totally frank with people, and the Prime Minister, I thought, was very, very strong on Friday when he described the the risks that we face from this new variant. But it may be that the increase in transmissibility is much lower. And in that case, there will be almost no impact on our roadmap and on the future number of cases. And we just don't yet know. So that's why it's appropriate to continue down the roadmap, but people need to be cautious and careful. And we're anyway moving the balance more towards people taking personal responsibility and trying to get away from some of the more intrusive rules that we've had to have in place. But of course, we also are absolutely clear that we'll do what it takes to keep the public safe as we learn more about this particular variant and about the virus overall.
So you said that if transmissibility is that high, then there will be a problem. Does that mean that, even though I know that the Prime Minister has said that the changes, they want to be cautious but irreversible, may you have to row back on some of the changes that are happening tomorrow?
Well, I very much hope not. And our goal remains, as I said at the start, our strategy remains to take a cautious and irreversible approach to ensure that we're always looking at the data all the way through, and crucially, to use the vaccine to get us out of this pandemic.
If you're looking at the data, if you're following the data, not the dates, it would be correct to assume that the changes happening tomorrow may have to be reversed if the data says so.
Well, that's not what I'm saying. I'm saying that actually the news and the data that we have, the information we have about the variant thus far, tells us actually that our strategy remains on track. It's just that in this race between the vaccine and the variant has got some more legs. I mean, that makes it more challenging. But the overall strategy of getting us out of this by vaccinating is on track, and it's only on track, and I just really want to stress this for all of your viewers, it's only on track because of the very, very high uptake rates of the vaccine. And what's happening in Bolton right now demonstrates why it's so important for everybody to get vaccinated when the call comes, because the people who are ending up in hospital in Bolton with this new variant are largely people who are eligible for the vaccine but haven't taken the vaccine. So if you're eligible, if you're 38 years old or older, you haven't yet had your jab, please come forward now, because that is what is going to help you, but it's going to help the whole country to get out of this pandemic.
The Prime Minister has said that there could be serious disruption to stage 4 of the roadmap. That, of course, the changes planned for June, when the end of this kind of social restrictions is planned. How likely do you think that disruption is? I know it's difficult to say exactly.
Yeah, it's the question everybody's asking, and the answer is it's too early to tell. What I can do is give you a timeline, which is that we're going to monitor all of this data. There's new data coming in every single day, and then we're going to take and announce a decision on the 14th of June. As always through this pandemic, we'll be as transparent as we possibly can be with the data. You know, you can follow it all on coronavirus.gov.uk. And we'll obviously keep answering questions about our best judgment about that decision, and then we'll take it on the 14th of June. So I'm really sorry that I can't answer that question. It's because it's too early to say, and that demonstrates this, this dictum that we have, which is that we follow the data, not the dates. We'd love to take that step if it's safe to do so. But we'll keep monitoring and make sure that we keep people safe.
Understood. Would any changes happen nationally? Or could we see a system where areas of the country with higher incidences of cases, hospitalisations, whichever measure, have different restrictions to elsewhere?
Yeah, well, we don't rule that out. The approach that we're taking in Bolton and in Blackburn is to absolutely pile in testing and vaccinations to try to get on top of this. When we had an outbreak of the South African variant in South London last month, we put in a huge amount, hundreds of thousands of tests in surge testing. People came forward in their droves across Southwark and Lambeth and Wandsworth, and we got that under control. That was the testing, tracing system working very effectively to clamp down on an outbreak. Now, we're taking the same approach in Bolton and in Blackburn. We've put in a huge amount of testing. We've reinforced that with army personnel as well, and we're expanding the vaccination programme, especially for those second jabs, which are the best protection against ending up in hospital. So at the moment, we're taking the approach that worked in South London, which is this massive surge testing. But of course, we don't rule out further action. And, given though that Bolton has been in some kind of a lockdown for a year, it's not a step we'd want to take. But of course, we might have to take it, and we will if it's necessary to protect people.
Now, I want to talk to you about borders, because there's a lot of people who are looking at the situation and thinking this could have been prevented. This could have been prevented if the government had acted more quickly. So the India variant first detected in the UK in the week ending the 29th of March. On the 2nd of April, it was announced that Pakistan and Bangladesh were going on the red list. India wasn't, even though there were much higher case numbers in India. And it wasn't added to the red list until the 19th of April. It didn't actually implemented being on the red list until the 23rd of April. This really matters, doesn't it? I mean, it was too slow.
No, I mean, I've seen this argument be made in some places, and it's frankly completely wrong, and it misrepresents how these the evidence on which you can take these decisions. So, this variant was notified as a variant under investigation after we'd already put India on the red list. The decision to put India on the red list was taken because of the high positivity rate of people coming from India and looking at the epi curve in India. When we put Pakistan on the red list at the start of April, that's because the proportion of positive people testing positive coming in from Pakistan was 3 times higher the proportion coming from India. And it was only after we put India on the red list that this variant went under investigation, and then later, it was earlier this month, that it became a variant of concern.
Some will be wondering,
and so
it shouldn't
the honest
just
truth
be about
is,
new variants, should it? The case numbers are also something that surely should be looked at. If you just look at the data from the 16th of April, for example, there are 137 daily new cases in India per 1 million people. In Pakistan, that number was 22. In Bangladesh, it was 33. And between late March and the 26th of April, 122 people arriving from Mumbai and Delhi had the Indian variant. They're just the people that we know about. Surely it was too slow.
No. So the first thing is, we have some of the strongest border measures in the world, and all of those people went through a testing regime. All of those people needed to go through a testing regime and an isolation regime. But the second point is that what matters is the positivity of people coming to this country. So you can't actually just compare those test positivity figures as you did, because it depends on the proportion of people being tested in those countries. However, because of the surveillance system we have here in the UK, because we test everybody who comes through the border, we therefore do know where the risks are. And that's why we took the action we did on Pakistan and then on India. As I say, before this was a variant under investigation. So yes, it is absolutely right that we have these tough border measures. And sometimes I get attacked for having these tough border measures, and I don't regret them at all. But you have to take decisions based on the evidence that you have. You can't take decisions based on evidence that you don't yet have. And we took the precautionary decision to put India on the red list based on the epidemic that we saw there, and then afterwards this variant was put under investigation.
And of course, you can't take decisions based on trade deals that you don't yet have either. Prime Minister due to travel to India in late April to try and secure, of course, that all-important post-Brexit trade deal. Bit tricky if India was on the red list, but I guess you're going to tell me that had nothing to do with it at all.
Well, we take these decisions based on the evidence. And we just had a discussion of the epidemiology and why we took the decisions when we did, and the fact actually that we took the decision before we knew about this variant as a variant, even under investigation, let alone it then being notified as a variant of concern.
OK. Very quickly, is it right that you're opening up vaccinations to over 35s from tomorrow?
That is not quite right, but as you can see from the progress that we've made, we are able to, we are expanding down through the age ranges pretty rapidly. I'm 42 and I was vaccinated a couple of weeks ago. It's now open to 38-year-olds and over.
OK, a little bit more time for me to wait then. Hopefully not too much. Not to be selfish about these things, obviously. Finally,
everybody should be enthusiastic. It's not. There's nothing wrong at all about being enthusiastic about getting your jab.
I am also just, of course, the restrictions tomorrow, some of them being lifted. How cautious should people be? Are you going to be going around hugging people yourself, or are you going to be trying to take a more cautious approach from that than that?
Well, I think we should all be careful. We all know the risks. Outside is safer than inside. So even though you can, from tomorrow, meet up inside, it's still better to meet up outside. Of course, there's people who have been yearning to have some physical contact. You should do that carefully. If you've had both jabs more than 2 weeks ago, that's much safer. So, I was asked this on Tuesday, and I said the thing I'm really looking forward to is hugging my mum. She's had 2 jabs, of course. Actually, Dad got quite upset about that. I'm really looking forward to hugging you as well, Dad. But we'll probably do it outside and keep the ventilation going, hands, face, and space. We all have a personal responsibility. We all know now the sorts of things that are riskier, but we're able, because the case numbers are so low, to move away from some of the more restrictive interventions. And anyway, I think personal responsibility is an important mantra here, because people have been so responsible through the crisis, and they've really listened and followed the guidance and the instructions that the Prime Minister's set out. And that's the approach that we should take together. But it's really good that we can take this step.
And just finally, just one more question to squeeze in. It's about the Prime Minister's holiday, because the Daily Mail reported this weekend that the Parliamentary Commissioner for Standards found he hasn't been transparent about that 2019 Caribbean holiday. It was worth more than twice the £15,000 he declared it to be. The bill hadn't been met by the Conservative donor David Ross, as the Prime Minister claimed. Whether it's luxury holidays or expensive wallpaper, why doesn't the Prime Minister just buy things that he can pay for and afford?
Well, I think, frankly, there's so many more important things. And I think that's what the voters concluded at the elections a couple of weeks ago.
Which is why we spent the majority of the interview talking about COVID and one question on this. But it is an important question.
Yeah, and I'll tell you, do you know what I'll tell you? I'll tell you what I really think, Sophie. When we were campaigning in those local elections, I knocked on one door in Middlesbrough, and this guy opened the door, and without me saying anything, he said, "You tell Boris, I don't care about wallpaper, I care about the fact you got me my jab." And that's the approach that I'm taking.
So journalists shouldn't ask politicians about whether or not the Prime Minister's broken rules? That doesn't matter?
You can ask me what you like, and I'm going to talk to you about what I'm doing and COVID. And the Prime Minister's followed the rules, we all know that. What matters for this country is getting through and out of this pandemic and making sure that we can then have a great decade in the rest of the 2020s. It's been pretty tough times. I know there's endless questions about this sort of thing. But I'm confident that the rules have been followed. And what I do is I concentrate on what's important for the nation.
OK, Matt Hancock, thank you very much for being on the programme this morning. Thank you.
Thank you.
Health Secretary Matt Hancock there. Well, let's stick to the theme of COVID-19 and the India variant. We're joined by the former Chief Scientific Advisor, member of SAGE, Sir Mark Walport. Thank you very much for being with us. How concerned are you about the India variant?
Well, I mean, there's good reason to be concerned, as you've heard. So there's a high degree of confidence that this virus is more transmissible, and a realistic possibility that the increased transmissibility over the current so-called Kent variant, B117, is up to 50% more transmissible. And you've just had a discussion with the Health Secretary, dissecting those different points. But I mean, there are clearly grounds for concern, but there is substantial uncertainty. And that's been the challenge for policymakers throughout the whole pandemic, which is that they're always having to make decisions in the face of incomplete evidence. The job of the scientists is to present that evidence as clearly as we possibly can.
And Matt Hancock said that if it is 50% more transmissible, then there'll be problems.
Yep.
What would those problems look like?
Well, I mean, the problem will be that the infection will take off, and there'll be very large numbers of infected people, particularly amongst those people that haven't been vaccinated yet, people who are only partially protected because they've had one vaccination. And again, as you've heard, in a small percentage of cases, the vaccination, for whatever reasons, doesn't work. And so whilst it is perfectly true that the vaccines, and it's been a remarkable story, and we've got 2/3 of the adult population with one jab in their arm and half of that number with two jabs approximately, does protect you against severe infection and death. Nevertheless, that isn't complete. And the challenge essentially is that a small fraction of a very large number, that's the particular people who are potentially infected, gives you a lot of people that could be quite sick.
Given that, do you think it is the right decision to go ahead with Monday's unlocking?
Well, that is the decision that policymakers have to make. It's why it's easier to be the scientific advisor than it is to be the politician. The answer is that I think that you are hearing them all saying, well, please be cautious. And the addition of fresh air to the hands, face and space, I think is extremely important. That is the most important thing of all at the moment. And the good thing about the time of year, although the weather hasn't been great, is that it is possible to spend much more time outside. And so if you can do things outside, you should. And if you're doing things inside, then make sure the windows are open and it's being properly ventilated.
If fresh air is the most important thing, I understand that it's a decision for politicians. It's difficult for scientists, for members of SAGE. But if fresh air is the most important thing, why are we going ahead with the expansion?
Again, you've been asking Matt Hancock that. Each of us will have our own opinions, but I'm not elected, you're not elected. So, my job is to help let people know what the science actually says. And it's the job, of course, of Patrick Vallance and Chris Whitty to provide that direct advice to ministers. And it's perfectly clear from the interview with Secretary of State just now that he's hearing the evidence and he's having to make quite tough decisions in the face of uncertainty. But I think the critical thing at the moment is to, firstly, that vulnerable people who have not been vaccinated really need to get vaccinated. And that's why it's important that there's these efforts to surge the vaccination to the people that are eligible in places like Bolton and Blackburn and other parts of the country. So that's really important, because if you haven't had a vaccine, you really must have one, actually. There's no good reasons for not. So that's the important thing. But then it is, I think, a question of people making judgments. And, my personal judgment is that I will do things outside as far as possible.
So you're not going to be heading to indoor pub tables, then? You're going to be staying outside?
Outside, I think, for the moment, yes.
You're talking there about the evidence that scientists are presenting to government in which they can then make the decisions. So what does the evidence suggest might happen after Monday's changes? Are we likely to see a rise in infections or hospitalisations?
So the control of this infection still depends on two things. It depends on social distancing, because the virus basically has to transmit by proximity from one person to another, essentially, and the effectiveness of the vaccine. The vaccine program is amazing. It's a tremendous logistic achievement, and it has had a huge impact. But we now have a virus that is even more able to transmit than its predecessors, so it becomes a tougher race. And so, that's the critical issue at the moment.
If you're looking at the sort of SAGE minutes that were published yesterday, which were saying that there is a realistic possibility that the India variant is 50% more transmissible than the Kent variant. And if that's the case, it's likely that progressing with step 3 alone, which is the changes on Monday, would lead to a substantial resurgence of hospitalisations similar to or larger than previous peaks. That's quite shocking, it feels.
Well, I mean, it's a very clear statement, and there's good evidence to back up the statement. But it's why it's going to be extremely important to keep a very, very close eye on the numbers over the next few weeks. And one of the troubles with this pandemic throughout is that there is a gap between someone becoming infected and them ending up in hospital, and then potentially the terrible outcome of them dying or being severely disabled by the disease. And so you're always playing catch up in terms of looking at the numbers. Now, case numbers at the moment nationally are fortunately low. There's about 2,000 cases picked up each day. But we do know, for example, in Bolton, the case numbers are much higher, at just over 200 per 100,000 of the population. In Bedford, there are about 100. So we've really got to keep an eye on the numbers. So test, trace, and isolate is really important. It's critical that people do get tested and do report if they have symptoms and isolate themselves and their families. These are all really important things. And we are going to learn over the next 2 or 3 weeks what the impact of the changes is. And the problem is that the data takes some while to emerge. Which is why there's every grounds to be very cautious about the ability to open up in June. But I mean, I think it's fair to say it is a perilous moment. We have a variant that shows good evidence of being more transmissible and possibly significantly more transmissible. We're going to have to watch the numbers extremely closely. And the other thing that we do know is that this new variant from India is actually quite widely distributed across the country. So we know about the hotspots, but it is in all 4 nations. There's a fair amount of it about, and it is increasing in proportion in terms of when the genomes of the cases looked at. We also know that it's in at least 60 countries around the world. It's in a number of countries across Europe. It's in the United States. And it's doing what previous variants have done, which is that as a fitter variant of the virus emerges, it takes over as the dominant strain around the world. And if you like, the relief with this variant is that the evidence so far suggests that the existing vaccines do protect against the most severe effects of the infection and death. But we still have a certain amount to learn. We don't know how much the vaccines protect against people getting milder infection and their ability to transmit to others. And that's why this constant vigilance is absolutely critical.
You mentioned the June unlocking. Of course, Matt Hancock made it very clear that that is under review.
Sure.
Do you feel that normality has got a little bit further away for us?
Well, I possibly, but I think that people have said all along that, this is a very pesky virus. It's very versatile in its ability to, change and evade. That's what viral evolution is all about. And so, complete normality, I think, is going to take a bit of time to return. And people have got to be sensibly cautious, I think.
Sensibly cautious. What would your advice be then for people from Monday?
Well, my advice is that, just because you can do something doesn't necessarily mean you should. As far as possible, socialise outside, maintain social distancing. If you're going to hug cautiously.
How do you hug cautiously?
Well, you don't. Well, without going into great demonstrations. Tight clinches should be avoided.
Cautious hugging, I love it. Thank you so much for being on the programme and sharing some of your expertise, Sir Mark Walpole. Always good to speak to you. Thank you.
Thanks.
Before we move on, a reminder, do check out the Sophy Ridge on Sunday podcast. We record it straight after the show. It features the best bits of our interviews, plus some analysis from me and the team. And today we're going to be going over everything we learnt from our guests about the India variant, of course, what it's going to mean for the roadmap. It'll be available from lunchtime on the Sky News app or wherever you usually get your podcast. The last one from me for a bit as well, so do check that one out. Now, the question that many people, of course, are asking, we've been asking it already in the show, is whether we need to really worry about the India variant if vaccines are still effective against it. We can sort of deep dive into vaccinations now and that variant and discuss that with Professor Adam Finn, a member of the Joint Committee on Vaccines, which advises the government. Thank you so much for being on the programme. So just let us know what the evidence shows on how well vaccines are currently working against the new variant, and whether or not there's any discrepancy or if some vaccines work better than others.
Hi, Sophie. Yes, so important to say that difficult to be very definite about this particular variant and the vaccines, but we can say quite a lot from what we know already from all the different versions of the virus and the different vaccines that we've been studying through the year. And the one piece of reassuring news is that we've seen consistently good protection against severe disease with different vaccines and different viruses so far. And so I think we all are cautiously optimistic that that will continue to be the case, also with this version of the virus. Excuse me. What we're less sure about is how well the vaccines will be able to impact on milder disease and in particular impact on transmission of the infection in the population. So that remains to be found out. But I think people should feel reasonably confident that if they're fully vaccinated, their risks of serious illness will be much reduced, also against this version of the virus.
If the uncertainty is around transmission or milder disease, does that really matter? I guess it would be my question. If it doesn't necessarily then lead to hospitalisations or deaths, should we be a bit more relaxed about whether or not the disease can keep spreading?
Yes, it does matter because it's through transmission in the population that the virus finds the people who are still vulnerable. There are older people and vulnerable people who've not been immunised. There are amongst them, as Sir Mark Walport was just saying, individuals in whom the vaccination has been given, but it hasn't produced good protection. And the more the virus is moving around in the population, the more chances it has to find those people and with them ending up in hospital or very seriously ill. So transmission really does matter. And as we move down through the population, that is increasingly the aim of the vaccine program, to try and achieve population immunity and prevent and provide that indirect protection and prevent hospitalizations that way as well.
Given impacting transmissibility is so important, like affecting the spread of the virus, do you think it would be a good idea to really prioritise vaccines in the areas where we've seen hotspots of the India variant?
Yeah, we had a lot of discussion about this last week, and I think the real concern is that because vaccine supply at the moment is the rate-limiting step, if you start moving vaccine around from one place to another or from one group to another, what you end up doing is disrupting the overall protection of the population that you need 2 or 3 weeks down the line when the vaccines have had a chance to work. And you end up chasing the virus around and always arriving too late. Vaccines are a really useful tool to prevent waves of infection, but they're not terribly good at preventing them once they're in full swing, if you like. So our conclusion was that we would probably do more harm than good if we started making the program more complicated, more difficult to deliver, and basically slow things down elsewhere.
Another big decision that the JCVI has taken is about this dosing advice and this change to the recommendation that the 12-week gap for the over 50s should be cut to 8 weeks. We've been told, though, haven't we, that the optimum gap is 12 weeks, that you get better immunity if you leave it that little bit longer. Was that a difficult decision to make? Was it unanimous on the JCVI, and what's the thinking behind it?
It's certainly a difficult decision to make because, as you've correctly implied, there's a gain side and there's a loss side to this. The fact is that the reduction in dose interval is relatively small. In practice, the second doses were mostly being given around 10 or 11 weeks, and now it'll be around 8 or 9 weeks. That will, in fact, mean that the size of the booster response that people get will be marginally reduced by having the dose earlier. But they will get it earlier, and there's a substantial additional protection that you get from that second dose. And we're now in a time of high risk when people really need to have that protection as quickly as possible. So, yes, it's a balancing act. But on balance, I think we all agreed that this was something that could be done. The folks in NHS England were able to tell us that the logistics could rise to this challenge. And I think it will do something to reduce the risks of this anticipated third wave that could follow a dissemination of this variant.
The size of the booster response will be marginally reduced. I mean, people will get a little bit less protection from the vaccine, is what you're saying?
Very marginally, yes. What's clear is that spacing the dose out gives you a bigger response when you do get that second dose. But you have to take into account the risks you're facing now when you decide what to do. And we really want people to be as well protected as possible in a month's time, just in case this variant is raging around the country and causing real problems.
So was the JCVI unanimous in the decision?
Yeah, I'm glad to say throughout the year, we've been meeting every week several times, and we've always been able to achieve a clear consensus. We've never had real conflict within the committee. It's a very functional committee. Everyone listens to everyone else, and we've always been able to reach joint decisions on matters of this high importance.
Yeah, always good to hear that, definitely. You're talking about supply being the rate-limiting factor. Does speeding up the dosing for the over the 50s put any of the other rollout targets at risk?
Happily not. So what we're doing at the moment is using our supplies of the AstraZeneca vaccine almost entirely for giving second doses. Those are available. The logistics in terms of delivery was feasible. And because we've got such an amazingly efficient mechanism for making appointments and people showing up so promptly and reliably, we can do this without really having any impact or negative impact on any other aspect of the programme.
If it really is a race, and it does feel like it's a race, that's what Matt Hancock was saying, you're talking about the importance of getting vaccinations out as well as quickly as possible. Could the JCVI look again at this recommendation that the under 40s should be offered non-AstraZeneca jabs if it means that it could speed up that rollout?
Yes, absolutely. That's on the agenda. And if necessary, that's something that could be done. When we expressed a preference for non-AstraZeneca vaccines for this age group, it was done in a very provisional way on the basis of everything going absolutely right. And if the evidence shows that the risk-benefit balance for people in their 30s is to be offered that vaccine, then absolutely that recommendation will be changed. At the moment, we don't think that's necessary, but it could well become a recommendation in the future.
That's interesting to hear. Also looking ahead to the future, and President Biden laid out plans last week to vaccinate 12 to 15-year-olds quite soon. What's the latest on the policy on vaccinating children in the United Kingdom?
Well, we've just started having discussions about this. Clearly, it's something that needs to be thought about. But I think the consensus at the moment is that children are very much not the priority. Very few children getting ill, very limited amounts of transmission being shown to be occurring in schools despite having reopened. And so the real focus at the moment remains with older people and people who are vulnerable, including children, of course, who are vulnerable, so that they get immunized. And immunizing children is something very much for the future and not for the present.
OK, thank you so much for coming on the programme. It's always good to speak to people like yourselves about these very complicated issues, so thank you.
Thanks, Sophie. Cheers.
Well, Matt Hancock was saying earlier that tomorrow's easing of those restrictions in England is going to be going ahead, but of course the loosening planned for next month could be impacted by the India variant. So let's try and work out what Labour's position is. We can ask the party Shadow Community Secretary Steve Reid, who joins us now. Thank you very much for being with us.
Good morning, Sophie.
We've been talking a lot on the programme about the planned unlocking for tomorrow, hearing about the risks, the balance of risks, and of course we'll be able to socialise indoors with up to 6 people. Should the changes tomorrow go ahead or should they be delayed?
Well, I've just been listening to the scientists on your show there, Sophie, and they seem very clear, don't they, that easing the restrictions tomorrow is the right thing to do. We needn't be alarmed enough yet to reconsider that, although the question about what happens in June remains. Now, the problem for me is why has the road out of the lockdown become so much more uncertain than it looked just a few weeks ago? And the answer to that is the Prime Minister is not always following the science in the way that he ought to be doing. It was just a few weeks ago, I was on your show and we were discussing the Prime Minister's plans to visit India to speak to the Indian Prime Minister, Narendra Modi. And as a result of that, Pakistan and Bangladesh had been put on the red list, but India had not. And it didn't go on the red list until three weeks after those other two countries, although the virus was running out of control in the whole of the subcontinent. Now, during that 3-week period, 20,000 passengers came back from India to the UK, and the Indian variant appears to have got into the country because of that. If the government was prioritising the protection of the borders, we may not even have this level of uncertainty. Now we have to deal with it. Now we're trying to understand whether this new variant is more contagious or not. But frankly, we shouldn't even be in this position if the government was protecting and securing the borders in the way that they ought to do.
I understand the debates about whether or not the government should have acted sooner to try and tackle the India variant on borders. But just want to go back to the question about what happens tomorrow, because you were saying that the scientists were quite clear. My sense is they're not totally clear on whether it should go ahead tomorrow. Mark Walport talking about, the risks. Matt Hancock saying there's going to be a problem if actually it is 50% more transmissible if the unlocking goes ahead. We've got this sage advice, of course, saying that if the India variant is up to 50% more transmissible, then that actually could lead, the unlocking tomorrow could actually lead to a resurgence in cases and hospitalisations that equals or even exceeds the previous peaks. So is the science really clear? I'm not sure it is.
Well, we don't know the answer to some of the questions you're posing there, Sophie. And the India variant seems to be more prevalent in certain parts of the country at the moment than elsewhere. And this is always going to be a balance of risks, isn't it? The risk of keeping the lockdown longer and all of the damage that that's doing to the economy and lives and livelihoods, and the risks in opening up. Now, we're in a slightly riskier situation than we should have been because of missteps the government's taken over protecting the borders. But I think right now, the judgment to take is that we should go ahead with the lockdown, easing of the lockdown tomorrow, keep a very close eye on what developments are so that we can review whether the planned opening later in June is the right thing to do. But short term, we need to make sure that the measures are in place to contain the variant or the virus in those areas where it seems to be gaining more of a foothold. And that means looking at contact tracing and making that work far better than it has previously. People who have been self-isolating at home, we understand only 3 in 100 have been contacted. That's not acceptable. That system has to work far better than that. And the other core issue that I also heard your previous guest refer to, excuse me, is self-isolation payments. If people are afraid they will lose income by self-isolating because they're on low pay or insecure work, then we run the risk that they won't be able to afford to do it, and therefore people will be moving around in society and potentially transmitting the virus. We have to fix self-isolation payments and we have to get contact tracing working far better than currently if we're going to keep a grip on this variant, whether it's more contagious or not.
OK, so Labour's position that tomorrow's unlocking should go ahead, the one in June should be kept under review. If the data suggests that actually the transmissibility is what some of the scientists fear, then should we be prepared to reverse the changes coming in tomorrow?
We always have to be prepared to do that, don't we? If the science tells us that the situation is no longer safe and we're heading towards another more serious and prolonged lockdown, then we're in trouble. Now, the previous decisions that the government, dodged really, like the circuit breaker that SAGE was recommending to the government back in September, October last year. Because the government didn't do that, we ended up with a much higher rate of infections over Christmas and into the new year, and a rate of deaths that really could have been avoided had the government acted earlier. None of us want to be in that position again. So if the science is telling us that this variant is more infectious than it may well be at the moment, then of course that must always be kept under review, because that's the way that we prevent a more severe and prolonged lockdown later in the year.
Should we be prepared to impose restrictions regionally or locally in hotspot areas, or should we always be looking for national a national picture?
Well, I mean, my view is the regional tiers didn't really work very well last time. They very quickly broke down because people move around. I think the lesson from that for me is it's best if we move together. If we move together as one country. But there are things the government should be doing in the meantime. And I think particularly what I was saying about contact tracing, self-isolation payments, those are if you talk to local leaders, regional mayors, council leaders, public health directors, they tell you that these are the things the government needs to focus on. They have not been working well enough up until now. It's urgent that the government fixes them if we're going to contain the virus without running the risk of a longer and more prolonged lockdown.
How are you going to act tomorrow? Mark Walport told me that we should be hugging cautiously. Matt Hancock said he's going to be hugging people outside. What's your policy?
I mean, we need people to behave with, as much restraint as they can. I'll be going into Parliament tomorrow, so I suspect I won't be hugging very many people at all. But I think we can trust the good judgment of people. We know this variant is out there. We know this thing isn't over yet. The British people have behaved with extraordinary self-restraint over recent months. All of us are desperate to get out there and get back to our lives as they used to be. But we have a little further to go until we're at that point, unfortunately.
Sorry to hear that if you're kind of being cautious over your hugging, there's not many parliamentarians that are going to make the cut there. Now, I want to talk a little bit about Labour. It's been a difficult few weeks for the Labour Party, I'm sure you'll admit. There's a lot of criticism that people just don't know what Labour under Keir Starmer stands for. And it feels as if the Conservative Party messaging is kind of drilled into all of our brains. Get Brexit done, levelling up, building back better. And if I'm being honest, I was trying to remember what Labour's slogan was going into May's elections. And I actually couldn't remember it. What was it?
Secure the economy and protect the NHS was the core of the messaging that we were going into those elections with. But the point you make is right. Ever since the election earthquake for us of December 2019, Labour's clearly had an electoral mountain to climb. No one's made any bones about that. I haven't. Sir Keir Starmer certainly hasn't. And in between Keir being elected just over a year ago and the elections we just had, we've had the lockdown. So as leader of the Labour Party, Keir has still not been able to get out there and shake a real voter's hand or give a speech in front of a live audience. And with the country necessarily and understandably focused on the crisis and how we get out of it, it's been very difficult to find the space to start talking about a forward offer from the Labour Party. I mean, despite all of that, despite the huge disappointment of the Hartlepool result, if you look at the results across the whole country, they were much more mixed than they looked the morning after Hartlepool. We were picking up council seats in Sussex, in Hertfordshire. We won 11 of the 13 mayoral elections across the country.
So it was a good set of elections for you, was it then?
It was mixed. I'm not going to pretend it was good.
Mixed?
I absolutely admit we've got a mountain to climb, but it was a bit more mixed. And if we have a mountain to climb, which is how we've described it since the general election in 2019, then last week we had halved the Tory lead compared to the general election. That's progress, but it's not enough because we need to overhaul the Conservatives if we're going to win the next general election. But that was never going to be done in 1 year. No one ever pretended it could be done in a single year. And particularly given the circumstances of the pandemic, it's been very difficult for a party to come out and project a set of proposals for the future as we come out of the lockdown, as politics starts to normalise and we face the future again without the domination of the pandemic in all of our minds. That is when Labour can start to make its future offer to the country. And the Shadow Chancellor, the newly appointed Shadow Chancellor, Rachel Reeves, has already started doing that this week, talking about work, talking about the family, talking about the importance of place and community to people. We will start to flesh out a series of proposals around that, and we'll do it by talking to, reconnecting with and listening to the country so that the Labour Party's priorities reflect the concerns and priorities of the British people, perhaps in a way that they haven't done in recent years.
You've got to be careful talking about work. That's Angela Rayner's brief, isn't it?
The agenda that we will be developing will be for the whole of the Labour Party to talk about together.
Okay.
And Angela's a close friend of mine. She's a fantastic communicator. She's got a big role to play in all of this, of course.
Okay. I take your point about the difficulties projecting your offer during a pandemic. But the issue that people have is, have you actually got an offer to project? You know, secure our economy, protect our NHS, the Conservatives could say exactly that thing. It feels that people don't actually know what the big vision is. I mean, you're all close to Keir Starmer. What is it? What is the big vision, the revolution that many people want?
I genuinely don't think it's right for me to just sit here and describe to you what the outcome of a process of engagement with the British people over the nekext few months is going to be. If it's a genuine engagement, then we have to be out there and listening. But if we just take...
You've been doing that for 18 months. You've been doing that for 18 months. You haven't just suddenly... Keir Starmer hasn't just suddenly come into power. Some people would say that what I'm asking you for, I'm giving you a platform to speak to our viewers, to speak to people of the UK about what the big vision is, and you've actually ducked it. Isn't that exactly the issue?
Well, let's take work. Let's take work as one issue. We know that one of the problems is that there have not been enough good, new, secure jobs in every single part of the country, so that every place, every town, every city, every county can be the best place to grow up, the best place to grow old, and the best place to live and to work. That investment hasn't been coming in. So we've seen the good old manufacturing jobs replaced by low-paid, insecure jobs in the gig economy, and that isn't what people need to see. Now, we have to work out how we are going to work with the different regions to bring in the investments to sustain the good jobs of the future that can give everybody the security they need, that they can get a job in their locality that is going to see them and their families through the future. Now, one of the key ways of doing that is through devolution. It's through opening up power so all the decisions aren't taken in Whitehall, but many more decisions taken in localities by people who understand how their localities work better. Now, the government has been trailing for the last 2 years a devolution bill that was set out their proposals for that. We got the Queen's speech just last week. No sign of the devolution bill. They've dropped it. And the reason I think they've dropped it is because Labour won 11 of the 13 Metro mayoral elections. The Conservatives are frightened that when people see Labour in power, they like it, so they've dropped their plans for devolution. That is one of the key ways that we get the investment in and the infrastructure in to bring in the good jobs of the future, and the Conservatives are refusing to do it. So there's one area where I think Labour can start to hammer them very, very hard as we emerge from the pandemic.
OK, thank you so much for being on the programme, Steve Reed there, talking about COVID-19 and also Labour's journey from opposition. Thank you. Well, that is it for this Sunday, and actually for a little while from me as well. We don't need to completely explain the reason for that. From next week, you're going to be in the very capable hands of Trevor Phillips, the writer and broadcaster, plus, of course, the show's usual top stellar production team of Matt Lavender, Georgia Roberts and Toby Sculthorpe as well. When I'm back, let's hope that talk of new restrictions, new variants, and, of course, those dreaded daily COVID numbers are a thing of the past. And I just want to say it's, an absolute privilege to be able to share your Sunday mornings with you, particularly through the year that we've all just had. And I'm really looking forward to seeing you again already. Until then, stay safe and take care. Up next, I'm going to be on your screens a little while longer, not getting rid of me that easily. It's Sophie Ridge The Take, where I'm going to be going over what we've just heard with Sam Coates, our Deputy Political Editor, straight after this.